Welcome to my YouTube channel. Our today's topic for discussion is infective endocarditis. When it comes to infective endocarditis, here are some specific counseling points that a pharmacist might share with you. 1. Medication adherence. It's super important to take your prescribed antibiotics exactly as directed by your healthcare provider. Stick to the recommended dosage and duration of treatment to ensure that the infection is properly cleared. 2. Potential side effects. Antibiotics used to treat infective endocarditis can sometimes cause side effects like stomach upset, diarrhea, or allergic reactions. If you experience any unusual symptoms, let your doctor or pharmacist know right away. 3. Drug interactions. Some medications, including certain antibiotics, can interact with other drugs you may be taking. Make sure to inform your pharmacist or healthcare provider about all the medications, supplements, or herbal products you're currently using to avoid any potential interactions. 4. Prevention strategies. Good oral hygiene is key in preventing the spread of bacteria that can cause infective endocarditis. Regularly brush your teeth, floss, and visit your dentist for checkups. 5. Follow-up appointments. It's important to attend all follow-up appointments with your healthcare provider to monitor your progress and ensure that the infection is fully treated. Remember, these counseling points are just a general overview. If you have any specific questions or concerns, don't hesitate to reach out to your pharmacist or healthcare provider. They're there to help you stay healthy and provide personalized advice. Now let's move to our topic. Clinical presentation of infective endocarditis: fever, low-grade, persistent fever often present, heart murmur, new or changed murmur due to valve involvement, fatigue, feeling tired and weak. Its common symptom. Disease classifications: 1. Acute endocarditis. It has rapid onset, severe symptoms, and medical emergency. 2. Subacute endocarditis. It has gradual onset, milder symptoms, and less urgent. Risk factors include: 1. Intravenous IV drug use, increased risk of bacterial entry into the bloodstream. 2. Heart conditions, pre-existing heart valve defects or congenital heart diseases. Diagnosis: 1. Blood cultures, identifying causative bacteria in the bloodstream. 2. Echocardiogram, imaging to visualize heart valve abnormalities. General management approach for infective endocarditis: 1. Antibiotics, high dose for antibiotics to target the infecting organism. 2. Bed rest. Rest is essential to reduce strain on the heart. Long-term management for infective endocarditis: 1. Cardiac monitoring, regular follow-up to assess heart function. 2. Prophylaxis, antibiotic prophylaxis for dental procedures to prevent recurrence. 3. Lifestyle changes, promoting a heart-healthy lifestyle for education, patient and family education for disease understanding.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.